this presentation, first I'm going to talk about the theoretical pillars, and in connection to the interventions, and in connection to the personal alignment, and in connection to a clinical case that I have in mind, and also application of therapy. So when we talk about this humanistic and existential psychotherapy, humanistic orientation, my mind goes to Carl Rogers between 1902 and 1987 as being one of the founders of humanistic psychology. Although, according to Anastos 2020, humanistic psychology doesn't have any founders. This orientation, theoretical orientation, has been growing and growing, and Carl Rogers is one of the people or scholars who have talked a lot about this and kind of written articles, of course, as we know. And his definition of this humanistic psychology or humanistic orientation is encompass the holistic approach of many other scholars, a person as a whole, and the person as able and capable to make choices for their life, and their human existence are important, and they are willing and able to fully engage in their life once they have the choice and also the freedom. So basically, human being, they are acting according to their organic resources to make sense of their existential situation, both within and without, according to Rogers 1963. And the psychological existence relies on the person's unconditional self-worth. If the person have been conditioned to feel they have unconditional self-worth, that's also something to talk about. And surely we talk about the real self and ideal self, as constant interaction. Things are happening in this between, how we are seeing ourselves and how the world is seeing us, or how we are how we are being forced to see ourselves. The real situation at times is not, and the reality is not at times, is not the way we are seeing ourselves, based on many environmental, socio-political, and cultural situations that we are in. That's why talking about congruence as one of the main pillars of this humanistic orientation is very important. The congruence between how I am seeing myself and how I'm being perceived as. And that's one of the sources of pain and suffering, once the person is not feeling that they are being seen as who they are. So there is incongruence for the person's idea of who they are and who they want to be and what they have in mind. So that's why living paradoxes causing pain and stress and distress and suffering. So Carl Rogers' core conditions, he's talking about congruence, empathy, and unconditional positive regards. And when we look at, or with this orientation, looking at human mind and human beings' need, we can appreciate that with or without these basic pillars or basic concept or tenets of humanistic psychology, people are feeling that incongruence that we talked about now. So person-centered therapy that Carl Rogers has is the pioneer for, talking about the therapeutic relationship as part of the interventions we are offering, as the main part and the most important part of the intervention. And this client-centered therapy is about the congruence, not only for the therapist, and also congruence in the dealing with clients' complaints, being on the same line and offering those unconditional positive regard, and being congruent with the self as therapists, being able to put their assumptions and biases and worldviews apart and understanding what's going on for the person. So existential therapy for me, or I understand this as helping people to find their free will and their voice, their real self, understanding that they are important, they are capable, and they can self-actualize if they want, and being able to use the resources for creating that space for themselves. And the aspect of selfhood, who we are as the self, the possibility to owning ourselves and being able to living with the self and being transcending in that given self is very important. Surely we know about the Maslow's hierarchy of needs, and the part of the existential theoretical orientation. We do kind of get stuck once we are not able to getting into this top of the hierarchy. And usually clients coming from the with the experiences, oppression, abuse, systematic terror and colonization, maybe it's important to just focus on first to understand that the level of safety is where we have to work on at. And usually I see this way, Maslow's hierarchy, when I look at clients who are coming in without having that self-regard for themselves. They have never moved beyond the psychological or the physiological aspect of this hierarchy because they have lived in the survival mood because of their situation, right? So facing our own issues, and for the client seeing and facing their where they are is hard. So why this orientation is aligning, and where is that aligning? This is aligning the history of my life with the lack of freedom and the choices to find my freedom and the need for self-actualization and the concept of migration. That is one of my interests to always, because I see myself that I'm looking at my life based on the migration history and the separation, the losses, the anxiety, that part of the incongruency of where the person want to be and where the person cannot be. So that's how this orientation helps me to kind of be on top of the needs of not only myself and my clients, and understanding that they are going through same situations, maybe not. However, once we are not able to self-actualize, we are in pain. For whatever reason, in any kind of situation, life situation, once we are not able to be who we are in pain. So I'm presenting this case. I call her, my client, as Mina. Mina, I have changed some few factors in this situation and this client to protect her privacy. So she's 42 years of age. She was born and raised in Iran and immigrated to Canada at age 28. She's part of the LGBTQ community with the engineering background. So now she's working in retail. Basically, her main complaints are anxiety, dissatisfaction in life, and despair. And how I have been able to use my orientation to listen and to be there, to offer my unconditional positive regard for this client, is to offer her the safe space that she needs, to see that where she is in life is not what she had imagined for herself. And if she's right now is not the fully functioning, is because of what she has been denied, the idea of being able to live her life as she wants. And she has been denied that, coming from a country where systematic oppression, gender apartheid, and brutality is the case and is the source. So basically, here we talk about need for freedom, how we can manage a life according to our ideals. And the application of a humanistic existential theory is based on offering her this space to be able to explore her mind without being judged, without feeling that she is judged, and also learning that she can be non-judgmental about herself. And as part of my intervention is about helping clients to find self-compassion for themselves. So my presentation is short, however, I will add that basically when we talk about migration, immigration, not only that, but when we talk about pain and suffering, in my view, based on my orientation, we are talking about not being able to be and become. So I found this article by Rockwell and Brown that was interesting. They're talking about being and becoming. I appreciate these two concepts, and how these two doctors, they are talking about womanhood and referring to humanistic psychology as a source of connection and healing and growth. And I appreciated this article, and that's why part of my resources. And also the article by D. Robertis and Bland as a manual for existential humanistic self-development. They explore this therapy and how we can kind of bring it in, include it in our approaches and in our work with clients. So, and also the article by Meyer and van der Heijden, in how we, in terms of pain and suffering and fear, especially this article is about the fear of pandemic, how the pandemic situation caused a sense of despair, and how the existential humanistic psychological approach was used to explore clients dealing with the thoughts of death and the feelings of dying and the fear of dying. So I found it very interesting, and I put that as part of my resources.